So Miss Gilday always had two kids.
That's it. So
Thank you so much. Okay, welcome to 10 Things School Nurses and Health Office Staff Need to Know About Why We Immunize. We are so happy that you are here. Let's see. As reminders, please place your microphone or phone on mute unless you are speaking. You can use the meeting chat box to ask questions. We really encourage that to happen. And all of the handouts and videos and slides and links and everything is available after the training. So don't feel like you need to write everything down. You will have access to it after the training. As a disclosure, presenters have no financial interest or relationship with commercial supporters of this educational activities or with the manufacturers of any commercial products and or providers of commercial services discussed in this educational activity. This disclaimer is to make sure that we can offer this training and offer CEUs with it. If you don't know who TAPI is, we are the Arizona Partnership for Immunization. We are the statewide vaccine coalition. Our mission is to foster community wellness, advocate for good public policies, and best immunization practices. We love school nurses and health office staff and want to support you in your efforts to keep Arizona kids healthy. My name is Laura Smith. I'm the program manager of community education here at TAPI. I have a bachelor's in public health. I'm also a certified health education specialist. Joining me today for TAPI staff, we have Blanca Martinez in the chat and also Nicolene. In the chat, she is hosting the technical part of it. And then we have 3 guest presenters today. So we want to keep this training very interesting and informative. We have Lauren Krebs from ADHS, Gail Hawk from National Cervical Cancer Society, and Lynn Moriarty, who is a 30-year school nurse and now a community nurse. So you will hear from everyone later on. We have lots of information. We have slides, videos, handouts, guest presenters, Q&A opportunities, even trivia questions with prizes. So those trivia questions will be answered in the chat, so make sure you know how to use the chat box. We are so excited that you're here, and we would like to get going. So the objectives of the training are to discuss 10 science-centered, evidence-based concepts about why parents should vaccinate their children. We want to answer common questions and address any misconceptions by distinguishing facts from myths. And we want to also provide you with credible vaccine online resources that you can have for yourself, you can share with parents, and then also colleagues. So our goal of the training today is that attendees become knowledgeable on vaccine benefits and know how to talk to parents about how important vaccination is. I want to show a quick video about some things we have learned through vaccination.
I want to tell you about a time in American history so that it never repeats itself.
So it never repeats itself.
It was a harrowing time.
A heart-wrenching time. I could hear my mother warn me, "Seal, don't go out and play."
My family was ravaged.
Thousands and thousands died. I was scared.
So scared. And then one day.
And then one day, there was hope.
Before vaccines, there were few ways to help protect against deadly illnesses. Diseases like measles,
Meningitis,
diphtheria,
Hib,
whooping cough,
or polio, which killed my grandma's youngest son. Without vaccines, these threats can reemerge.
I'm here
to tell my children to help protect their children.
Get your kids vaccinated and keep them on schedule.
I never want my grandchildren to see what I saw.
The success of vaccines over the last 50 to 75 years has created a challenge called vaccine amnesia or public health amnesia. This happens when people forget how serious the diseases that vaccines prevent can be because they haven't seen them in a long time. As a result, awareness about these diseases decrease, and now we are starting to see a rise in preventable illnesses like measles, showing up more often in our communities. This situation reminds us how important it is to remember what has happened in the past, and so then we can protect the future. Understanding vaccine amnesia is essential for encouraging people to get vaccinated and help prevent outbreaks. So we are going to go through the 10 things that you need to know. The first one is kids are at risk for disease. This map illustrates the concept of public health amnesia. Measles was thought to be eliminated in the year 2000, but by 2014, new cases emerged in unvaccinated communities. By 2019, 28 states reported at least one measles case, indicating that outbreaks can still occur despite years without reported incidences. The situation is directly linked to lower vaccination rates and highlights that a disease is not truly gone just because it hasn't been seen in a long time. Continued immunization is essential for long-term prevention. Additionally, current trends show that whooping cough or pertussis is starting to resurface as well. And you can see Arizona is on this blue map here, is on the darker blue in the map here, showing that measles cases have been found in Arizona, including recently, as I'm sure you all have been hearing about on the news. Arizona kids are especially at risk. ADHS, the Department of Health Services, requires every school to report once a year on the coverage levels of kids enrolled in schools. This information is made available to the public, and parents can be informed about coverage levels. Our schools used to be at the 95% coverage rate, but over the past 10 years, the level of protection has begun to drop as the number of vaccine exemptions have begun to increase. Some schools have only a 40% coverage. Arizona has been identified as a hotspot because of these low coverage levels. The data indicates that diseases are still present and circulating. However, if people who have never experienced the disease may believe that they no longer exist or that it won't affect them personally. I'm going to show a video. It's very difficult to watch, but I am going to play it the full 2 minutes because it's really important to understand the impact of these diseases. So hang in there. It's about 2 minutes long.
They're just kind of heavy. Uh-oh. There we go. Okay. It's okay. Okay, take a breath, honey. Come on. Almost there. There we go. Oh my. It's okay. It's okay. Yeah. It's okay. There.
Okay, I hate watching that video. I've seen it so many times, but every time it just hits me. That baby is just struggling to breathe. She has pertussis or whooping cough, and this is a vaccine preventable disease if those around the baby get vaccinated for that. And then this young man on the right, he has mumps, not as common, but still is vaccine preventable. So. Number 3, outbreaks are preventable when parents make the decision to vaccinate. Traditionally, we prevent outbreaks by ensuring that 95% of the population is immunized against diseases. When this level, this 95%, is achieved, the disease cannot spread within the community. It's especially crucial for young children to be vaccinated before starting school, as that protects those around them. This concept is known as herd immunity or community immunity. So to visualize this, it's easy to think about a community immunity is like a fence with immunized individuals acting as planks in the fence. So if enough people are immunized or vaccinated against a specific disease, it protects those in the center, which would be young children or those with medical conditions. When a disease attempts to enter the community, it hits the fence, and then the vaccinated individuals prevent it from spreading. So outbreaks occur when there are too many gaps in this fence, or they're allowing the disease to pass right through and affect the unimmunized individuals, which increases the risk for everyone who is also unimmunized. Vaccination is the best way to keep our communities healthy. Number 4, vaccines work. They are studied, they are followed to see how well they are working, and they are continually tested and updated as needed to work even better. We want to ensure that you have solid evidence that vaccines are effective. When a vaccine is developed for a disease, it often leads to eradication, elimination, or significant reduction in cases, sometimes to almost 0%. So this chart here shows different diseases on the left in green, and then when they were eradicated or eliminated, what year, and then how much it has decreased. So you can see smallpox was eradicated in 1980, decreased 100%. Measles, the endemic spread in the US, was eliminated in the year 2000. It decreased 99.9%. However, with lower immunization rates, measles has begun to come back. I'll let you look at that for just a minute. The CDC reports that vaccines save around 42,000 lives each year, which is 3 times more than seatbelts and child restraints. Choosing not to vaccinate your child is like putting them in a car without a seatbelt. Most of the time, car rides may seem safe, but it only takes one accident for a seatbelt to matter. Likewise, a single exposure to a disease can make a child very sick with serious health effects, even if they survive. So I don't know about you, but our car does not leave the driveway or the garage until everyone is buckled, even the squirming toddler that wants to try to buckle herself, and the teenager that doesn't want to wear his seatbelt. The car doesn't move until everyone has their seatbelt on, because I don't want to take that chance with my kids to get into an accident, even in our neighborhood or, a half a mile away at Target, going to Target. Like, I don't want that to happen. So seatbelts are so important, and it's your responsibility to protect your kids as much as possible. All of my kids are vaccinated as well, because that's the best way to protect them. Number 5, vaccine offers protection to us, sometimes in different ways. So vaccines protect us from getting the actual disease, but newborns who are too young to get vaccinated are protected by their mother's vaccines. This is their first protection, but it does begin to wear off around 2 months of age. And so that's why the vaccination schedule starts when the baby's about 2 months, to continue this protection. Some people cannot get any vaccines. They are too sick or they have allergies. These people are protected by those around them getting vaccinated, just like the fence analogy. And then just as a side note, I think that it's important that you know only approximately 1 person in a million have a true allergic reaction to a vaccine. Some people get swelling or a rash or start to feel sick and think that's an allergic reaction. But a true allergic reaction is incredibly rare and is severe. It doesn't mean that it never happens, but 1 in a million chance. The CDC has researched the best time to give vaccines to offer the maximum benefit. And so really that schedule is the best one to follow. Number 6, vaccine antibodies act as personal ninjas to protect from the actual disease. So after someone contracts a disease, it can take several months or even years for their immune system to fully recover, leaving them vulnerable to other diseases. That's why getting vaccinated is important. Vaccines prepare your body to fight a disease before you're exposed to it by prompting your immune system to produce antibodies. Think of those as personal ninjas ready to defend against infection. In the past, 30 years ago, vaccines contained more antigens to protect against diseases. But they have since been refined and updated and require fewer antigens while still being effective and covering more diseases. Ongoing research ensure that vaccines are continually improved for safety and effectiveness. Okay, that's a lot of talking for me, so let's take a break and do a trivia question. Which vaccine is recommended during pregnancy? You'll want to put your answer in the chat. A, pertussis or Tdap, B, flu, C, COVID, D, RSV vaccine, or E, all of the above. If you are a winner, Blanca will be chatting you and we'll get your information and send you a prize. Okay, lots of A's, lots of E's. Ooh, I see a B and a D. Okay, this is great. There are a lot of guesses. Thank you so much for your participation. So the question, which vaccine is recommended during pregnancy? Give everyone a chance to put it in. The answer is E, all of the above. Currently, if you are pregnant, they do recommend you get a pertussis vaccine, flu vaccine during flu season, the same for COVID-19 vaccine, RSV vaccine. The answer is E, all of the above. So Blanca will be chatting you if you want a prize. Don't worry, we have several more opportunities. Number 7, babies get their first vaccine from mom. There are new recommendations focused on pregnant mothers that during every pregnancy, a mother gets a flu, pertussis, and COVID vaccine to protect her and her baby. It's important to talk to your OBGYN or have the parents talk to the OBGYN about when and where to get those important vaccinations. Many people have all members of the household get these vaccines to increase the protection for the newborn because these vaccines are given in pregnancy are the baby's only line of defense until they can get vaccinated at 2 months of age. I have a 3-year-old right now. She is in preschool and she loves it. But she was born January 2021 in the middle of the height of the COVID pandemic. And she could not get any vaccinations. So, and I actually could not get, the COVID vaccine was not approved at that time for me. So our whole family, the other kids and my husband, we all got our flu shots, the Tdap vaccine for me. And as soon as we could get vaccinated for COVID, we did, as well as the kids did too, all to kind of make our own little family fence around this little baby. She was medically fragile or high risk. And so we just felt like we had to do everything possible to protect that baby. So we were her first line of defense. Okay, and then it's very important to make sure to get your flu shot every year. You as a school nurse, health office staff, front office, you are the best defense against spreading the flu. So make sure that you get your flu shot. They are available now. I think in Arizona, we usually recommend late September into October to get your flu shot and get the rest of your family immunized, and encourage your students and staff at the schools to get their flu shots as well. Number 9, off to school equals up to date on shots. Vaccines are required when children enter childcare, preschool, or kindergarten to protect them and their classmates. It's really crucial that they are up to date on vaccinations before entering the classroom, because they will be in close contact with many other kids, making it easy for diseases to spread. Now, my kids started back to school in July, and boy, oh boy, have we had the sniffles and the little colds for a few weeks after school started. They are in close contact and sharing all kinds of things. And so it's really important to make sure all of the kids in your schools are updated. Keeping the children vaccinated helps prevent them from getting sick themselves, also protects younger siblings or older adults like grandma and grandpa, who may not be fully immunized or able to be immunized. Each state has its own vaccination requirements for school entry, so it's important to familiarize yourself with the guidelines for Arizona. The CDC website provides information for all 50 states if you're unsure about specific requirements. And number 10, kids still need protection as they grow. We talk a lot about baby shots, but the same recommendations for vaccines continue throughout their life. We recommend following the CDC schedule for immunizations. These schedules are updated with new and improved vaccines as they come out. You can go to the CDC website to review the recommendations. They even have a printable schedule that's easy to read. On our TAPI website, we have that as well. So we can make it real simple for you to know how to get updated on vaccines. Okay, so this is a very good scientific video. It talks about why vaccines work. It's a little bit long, it's about 7 minutes, but it's a really great foundation for understanding why vaccines work. If you have any questions, think about them as we watch the video, and then we can go through some questions in a little bit.
You doing okay, man?
I don't know. These negative thoughts just keep gnawing at me.
Okay. Sorry about that.
Aren't you glad you don't have scurvy? In 1747, in the first medical trial ever performed, Scottish physician James Lind found out that eating citrus fruits could cure scurvy. Now, today we know this works because citrus contains high levels of vitamin C. In fact, ascorbic acid, a common name for vitamin C, comes from the Latin for not scurvy. By issuing rations of lemon juice to sailors, the British Navy was able to pretty much eliminate the disease until the late 1800s, when polar explorers suddenly began to see scurvy again. The copper pots holding their lime juice had destroyed the vitamin C, but they were pretty confused. So despite James Lind's experiments 150 years before, citrus fruits became the enemy. And when Robert Falcon Scott set out to reach the South Pole in 1911, he carried the finest in canned meat products, biscuits, chocolate, tea, and zero vitamin C. A Norwegian team beat them to the pole by 5 weeks, and during their sad journey home, Scott and his team perished in a blizzard, sick and weak from what was probably scurvy. It had been so long since anyone had seen this disease, the British had forgotten how to prevent it. When we create such effective solutions, we can forget how serious the problems were. Thankfully, people today don't die of scurvy or polio. Since the introduction of Jonas Salk's polio vaccine in 1955, the disease has been nearly eradicated from the earth.
The thing to remember is that this is a continuous process.
Compare the 358 infections reported in 2014 to the 1940s, when 500,000 people per year were paralyzed or died from polio infections. Vaccines work. Our immune system is on constant alert against germy baddies, with millions of white blood cells each on the lookout for specific infections. When an immune cell meets its target, it replicates itself, and this clone army sends a barrage of protein weapons called antibodies to label the trash for cleanup. And after the infection is gone, so-called memory cells stick around, ready to mount a fast attack in case this germ shows up again. This is how we develop immunity, and it works pretty well, since we're all still alive. But even with all that, some super bad germs can take us out before our immune sentries have had time to call up their clone army. This is especially true for young children. Their immune systems are fresh out of basic training. Thankfully, we have vaccines, which are made of tiny pieces or weakened versions of viruses or bacteria. They let our immune system see what the bad guys look like and recruit those all-important memory cells before we ever have to actually see the real enemy. Thanks to vaccines, the US was able to eliminate measles in the year 2000. But in recent years, as more and more parents are refusing to vaccinate their children or are vaccinating them later than what doctors recommend, it's back. In most states, more than 90% of children are vaccinated, but that's not enough to keep a disease like measles at bay. In our episode about Ebola, we talked about a number called R0, the basic reproduction number for a disease, or the number of people infected by one person in a susceptible population. For Ebola, that number is low, but for measles, each sick person will infect up to 18 others. Luckily, vaccines can change that. The fraction of people who are vaccinated or immune can lower the reproduction number below 1, which means the disease is disappearing. 90% of unprotected people who come in contact with somebody who has measles, even just breathing the same air, will become infected. To control a super contagious virus like that, the vaccination rate has to be 95% or above. And right now the US is lagging behind, and measles is making a comeback. The Guardian put together a simulation of just how this so-called herd immunity works. When enough of a population is vaccinated, even if it's not 100%, the herd can protect the unprotected. With vaccine refusal on the rise, our herd immunity is breaking down. Preventable diseases like measles and whooping cough have become our scurvy. Most of us don't know anyone with polio, and measles. It's not that bad, right? Well, yes, it is that bad. Before the age of vaccines, millions of people were killed by diseases that today are just bad memories. Vaccines have let us develop a sort of generational amnesia. Today we expect our children to grow up healthy, and we're lucky that we don't appreciate just how dangerous these diseases are. Like science writer Seth Mnookin says, vaccines are victims of their own success. Because of stories like Andrew Wakefield's discredited study wrongly linking vaccines and autism, and the news media's obsession with pictures of crying, terrified children being poked with needles, people are nervous about vaccines. This anxiety isn't new, though. When Edward Jenner in 1798 saw that milkmaids didn't catch smallpox, he realized that because they'd been exposed to the similar cowpox disease, they were immune. And based on this, he developed an early smallpox vaccine by inoculating humans with the cow virus. In fact, the word vaccine itself has bovine origins. Still, as far back as 1802, critics were claiming that the smallpox inoculation would turn you into a cow. Vaccines don't come without risk. Nothing does. But on average, fewer than 1 in a million people will experience a dangerous reaction to common vaccines. Car accidents, playing outside, even walking will injure more children. Vaccines are asking us to do something altruistic, to make a choice to protect not only ourselves and our children, but also those around us. Author Eula Biss says that vaccines are one of the most empathetic things that we can do. A system that's based on people voluntarily using their bodies to protect other vulnerable people. That's something I hope we don't forget. Now, I'm a doctor, but I'm not that kind of doctor. It's natural to have questions about vaccines, and you should have a conversation with your medical professional. They want the best for you and yours. I will give you one prescription though, and that's to subscribe so you can get a full dose of science every week. And if you want to read some amazing books about vaccines, check out Seth Mnookin's The Panic Virus and On Immunity by Eula Biss. Links in the description. Stay curious.
I love that video because he does so well at explaining vaccines. Obviously, he's a teacher and understands it well, but I think it's a really great video. So hopefully you were learned something and were entertained by that.
Today we
Okay, so we are just headed into respiratory illness season. It's really important to keep kids healthy during respiratory illness season. Along with annual flu shots, COVID-19 vaccine is available for kids 6 months and older. There's also a vaccine that offers protection against RSV. We saw record high cases of RSV the last few years in Arizona, so it's important to encourage families to get vaccinated and stay healthy this season. I have a few different images just to go through. Flu vaccine, everyone 6 months and older can get immunized. Ideally by the end of October. Flu is a potentially fatal contagious respiratory illness caused by viruses that affect the nose, throat, and lungs. On average, 26.8 million Americans become infected with the flu every year. Flu vaccines are effective at saving and protecting lives and reduce the potential for serious illness. The CDC has this flu campaign on the left here, talking about how a flu vaccine can take the flu from wild to mild. It does not prevent the flu necessarily, but it does make the symptoms so much less that you'll be like a little kitty cat instead of this lion. Sorry, that scrolled funny. And then next, get protected against the latest COVID-19 variants. You can go to vaccines.gov to find a vaccine near you. Sometimes the doctor's office will carry it. Sometimes you have to go to the pharmacy, depends. COVID-19 vaccines have been thoroughly tested for both safety and effectiveness. These vaccines significantly reduce the risk of developing severe COVID-19 and long COVID. According to the CDC, it is safe and acceptable to receive multiple immunizations, such as COVID-19 and flu vaccines in the same vaccination appointment. Now, not everybody needs a vaccine against RSV. I am in my 40s right now. I am not on this chart. I am not pregnant, so I do not need to get a vaccine, but this helpful chart can show you who does. So adults 60 and over, babies can get the antibody when they are infants or if they are within that respiratory virus season. So up to about 9 months, I believe. And then all pregnant people during the weeks of 32 to 36 weeks of their pregnancy can get the RSV vaccine also. In addition to vaccination, we have these basic core strategies for preventing illness, right? We all know these things. Wash your hands, stay home if you're sick, get fresh air, all of that. And then additional prevention strategies from the CDC include wearing masks if you're in a crowded or environment or indoor settings, especially if community transmission is high or you yourself are exhibiting symptoms. Give plenty of space between you and others and test for illnesses as well. Okay, our first guest presenter, Dr. Gail Hawk, has a very big, long history of preventing illness with her nursing degree, her doctor of nursing degree, her passionate work for the National Cervical Cancer Coalition. We are so lucky to have her present. Gail presented for us maybe about 2 years ago for one of these trainings, and I said, please come back every time, talk about HPV vaccine, talk about cervical cancer, and what we can all do to do our part to prevent it. So Gail, if you are on, I will stop sharing and you can go ahead and share your slides for your presentation.
I'm here. I didn't have the chance to check my mic. Is it working?
Your mic is working.
Okay, perfect. And on your Zoom, where I know my Zoom, the old version, where is the share screen on the...
Yeah, that green button on the bottom toolbar.
Okay, there it is. It used to be on the top.
Okay.
You know, technology, right?
Yes, it updates all the time.
Here we go.
Okay, we're
it
good.
looks small. It looks really small to me. Can you guys see it?
Good. Yeah, we can see
Okay.
it.
All right. I've got two screens, so you never know. So if I'm looking the wrong way, you guys forgive me.
Okay.
I see that there are a lot of new names for me, at least in the room today, and the attendance is fantastic. I have presented this presentation, a little different version multiple times. So if I'm invited back, you'll get a little new piece about HPV and HPV vaccination and prevention through vaccination. And for those of you who don't know me, I was a school nurse for a long time. I started in 1991, and I think I saw a couple names that I was familiar with back from the 90s. And at that time, we were really involved with HIV prevention. And, you know, school nurses are boots on the ground for everyone. Your role is so important. When I was a school nurse, that's when I decided to go back to grad school because I figured I had to learn more. I really felt like I was like out there in the field by myself and needed more education. So that's what led me on my path to going from my BSN to my master's degree, my doctorate, and so forth. So it was my school nurse job that was the most challenging one I've had in my career. So hats off to all of you. So today I want to ask you, you know, school health, what's my role in reducing cancer risk? And I'm going to go over I got to look at my time. Laura, let me know how I'm doing on time. I'm going to go over some basics really quickly, and I will send these slides to Laura later today. I had some personal things come up this week. Okay, so our objectives, because I was a nursing professor, we'll describe the burden of disease related, the cancer burden of disease related to HPV infection. I'm going to talk about the difference between incidence and prevalence. It's our jobs when we work with families and communities that we can interpret some of these terms that can be very confusing and be misrepresented to the populations that we serve. So we are the translators of health information to our school population, and that includes principals and teachers too. I'm telling you, that was a big deal during when AIDS was first emerging in the United States. So you're going to discover HPV vaccination completion rates in individual Arizona counties, and then apply HPV vaccination standards of care in school nurse practice. Okay, so quickly, human papillomavirus is a very small DNA virus. It's very communicable. There are more than 200 types, 40 types infect mucous membranes, and we have those mucous membranes in our eyes, nose, mouth, genital area, and the whole gastrointestinal tract. So transmission is from close, intimate contact. And when I say intimate, I don't necessarily mean that it has to be, and I don't want to embarrass, I'm not, if I embarrass anybody, I'm sorry, but we got to talk frankly about this stuff. Close, intimate contact. And that doesn't necessarily have to be intercourse of any kind. It's mucous membrane to mucous membrane for a prolonged period. So we aren't 100% sure about how transmission happens, but we do know that that virus resides in the mucous membranes of the body. Okay, so most infections are asymptomatic, no symptoms at all, and they're transient. That means a person can get infected and clear that infection, and about 90% of people do clear the infection if they get an HPV infection. So the HPV types include the non-mucosal and cutaneous sites. That means cutaneous is skin, and so those are plantar warts, palmar warts, and other skin warts. And then we have the ones that are in the mucosal or genital infection sites. We have the high-risk ones that we call oncogenic or cancer-causing, and they can cause high or low-grade lesions of the genital tract, and also cervical, anal, penile. We'll talk about the sites more on the next slide. And then we have the low-risk types that go into mucosa, and they cause the more low-risk lesions and some warts. And they also can cause recurrent respiratory papillomatosis. This is kind of rare, but it's when baby goes through a birth canal and mom might not even know, remember, asymptomatic, that she has an HPV infection. And then that can get into baby's mucous membranes, and it causes lesions to grow in their vocal cords. And this actually happened to one of my niece's baby, and she called me and was telling me about this, that her son he's 9 years old. She took him to her pediatrician, the ENT doctor who lasers off those lesions routinely, at least once a year, said you need to get this kid immunized against HPV. We're finding some success in controlling these respiratory papillomatosis. And it's not indicated for that, but the kid needed the vaccine anyway. And so she lives in Texas, and pediatrician wouldn't immunize until that ENT doctor wrote a very strong letter so that her 9-year-old boy could be immunized. And it's indicated for that age. So we really have to be advocates for kids when we are in school health and working with families. Okay, so natural history of epithelial, again, that's mucous membrane HPV infection. See, it goes through that, it's called the squamous, squamous epithelium, I can't talk today. And the particles get in there, and this is the basal layer. So they can get in there and they can come in, and then you can see some greater disruption of a normal cell. The problem happens when those cells start really changing, and then they protrude below that basement membrane in the dermis, in the skin. So it's the top layer of the mucous membrane, the dermis is the bottom layer, and this is when the problem occurs, okay? So up till we get about here, that infection the person can often fight it off. It's when we get into the invasive cancer parts that the interventions need to happen, and also when we're in a high-grade lesion area as well. I'm talking about cervical cancer now, because we do have screening. Now, this is a new infographic for this group, and I love it. I wish I would have found it years ago, but it didn't exist. Today, all of my resources are on the bottom of the slide if you want to copy and paste and learn more, okay? I did not make a reference list today. So in the epidemiologist bathtub, and epidemiologists are the scientists that explore how diseases occur and change and are transmitted from one person to another, or from a hard surface to a person and all that kind of stuff. So we have the two terms I want to talk about today are incidence and prevalence. Incidence is the number of new cases during a specific time frame. So typically that would be a year. If you hear the incidence of COVID-19 during calendar year 2023, that means new cases of COVID-19 during calendar year 2023. But if then you heard on the news, well, they might have made a mistake though, because they didn't have this session like you guys are. Then if you hear about prevalence of COVID-19 would be possibly the same calendar year, let's say 2023, and it would be all the new cases and the existing cases. So that's the difference. Incidence is the new cases, these drips dropping out of the environment into people, and let's say the bathtub is the population, and prevalence would be all those new cases plus the existing cases. And then what happens to prevalence, it may decrease by recovery. The people recover, and so then prevalence no longer includes those existing cases, maybe in the next year, or unfortunately, people may perish and they could die, and that would be mortality. So really, prevalence is where the disease state happens. Incidence, it occurs, people get sick, incidence is added to prevalence, people may recover, prevalence would go down, or they may die and prevalence would go down. Any questions on that real quick in the chat box? Laura, can you help me?
I don't see any.
Okay, good. All right. So cervical cancer is just the tip of the iceberg when we're talking about cancers related to HPV. This is an older infographic, and really now the cervical cancer numbers are about 12,000 a year in the United States. And when we talk about cervical cancer, the only numbers that are captured in our databases are the invasive cancers. So when a person has pap testing and they have, let's say they have what's called CIN3, which is, in my graph when this cell started changing, Those numbers aren't even captured. So this is just the tip of the iceberg when it comes to HPV and cervical cancer cases. So I want you to remember that it's only invasive cancers that are captured when we talk about incidence and prevalence of cervical cancer in the United States or anywhere in the world. All right. So this is an annual report. This is new United States HPV associated cancers each year for females. So remember, we're not capturing any of those precancers at all that aren't showing up in the prevalence or the incidence rates. So here are these colors, and the colors apply to both males and females. And you can see that primarily 47% of the cancers reported are on the cervix. And then the second one is the anus with women, vulvar cancers, vaginal cancers, and then oropharyngeal cancers at the back of the throat. These are all, we usually just talk about cervical cancer and HPV, but it's important to know that there are this many cancers that are involved, but cervical cancer makes up the bulk of the cancers. So the 47% of this number was just multiplied it about 12,000 cases of cervical cancer. So more than we saw in that infographic last time. And then this one is for males. And I want you to see how close these numbers are, how close they are. 26,000 in females, 21,000 in males. However, cancers of the oropharynx, back of the throat, in males now are, and this is invasive cancers that need, chemotherapy, radiation, that kind of treatment, are higher, because I did not multiply this. I'm going to do it real quick. Times 0.82.
And Gail, you have 3 minutes left.
Oh, I better hurry. Thanks. Okay, so more, I didn't do the math. So more oropharyngeal invasive cancers now in men than cervical cancer in women. We don't have any screening for men, okay, for that. Or we don't have real good screenings for the back of the throat. All right, so this is an old saying that Dr. Melinda Wharton shared with us, that preventing, at a conference I went to years ago, preventing cancer is better than treating it. This is a great way to start any conversation with a family. I never got any pushback by saying this to families that I was working with. These are the HPV types that are included in the vaccine. Some are for genital warts, some are related to cervical cancers, and the rest are related to cervical cancers. And now, HPV related cancers in males. Okay, so it's cancer prevention. This is Chase Field. It holds about 50,000 people. What we do know, after you looked at those numbers, if we've had everybody vaccinated, we could prevent almost this many cancer cases in the United States. And I want you to think about the number of people sitting in that stadium. That's remarkable. And we all play a part in this, in the good work of preventing cancer in school health. This is the recommended schedule from the CDC. And up here, you'll see the range where HPV is recommended to be given. Recommended vaccines by the CDC are those that are recommended. You can see all the vaccines for teens are here. In Arizona, the only school all these vaccines are not school required. So there's a difference between a school requirement in legislation and the CDC's recommendation, but you guys all probably know that. And these are our numbers in Arizona. They're from last year. Just last night, I received the new numbers from ADHS, and you get these directly from ADHS, and they have to give you permission to share. But you can see that we're not doing a great job. We are not even at 50% Arizona-wide, and you can look at your own county and see where you stand. So what we're doing is we're leaving almost half of our population vulnerable to cancers. Those cancers I just discussed, and discussed. I am not okay with that, and I hope you're not okay with that too. We can make a difference. The 5th grade enrollment last year, the year that we send out the referrals for vaccination using the immunization screening and referral form that ADHS has provided for us, we fought and fought and fought and fought. Probably it's been about 10 years now to get HPV on the list. And remember what I said, required vaccines, meaning for school only, recommended vaccines from the CDC. All of these vaccines are recommended. These are the ones that are required by school. What I'm asking you to do on your 5th grade referral letters is just put a highlight through that HPV line. I hear anecdotally from providers that so the kid needs so let's say the kid needs a TD or a Tdap, you're going to mark that. You're going to mark anything they still need, and meninge probably, and you're just going to slide that highlighter along that last one, and you're going to do it for me and for all the cervical cancer or all the HPV related cancer survivors in Arizona. So again, here's our bathtub. This is what we want to stop with HPV. We want to stop the incidence, the new cases, and we do this with vaccination. It's very, very successful. It's a safe vaccine, and each and every one of you that have a 5th grade to 6th grade population have an opportunity to make a difference. One of the reasons this is really important to me is that I had cervical cancer at 27. I had married a man who was 13 years older than me, and I met him when I was 19 years old, and we had 2 kids together, but this was 6 months before my diagnosis. We can't control the behavior. My first husband, he had a life before he met me. He was in his 30s. I think he was 32 when we got married. No, 35 when we got married. And or 32, can't really remember. Anyway, so important to vaccinate. The woman who introduced me to my first husband when I was 19 is a pastor. I saw her this week. She has stage 4 cervical cancer. She was diagnosed last year. We are going to be 70 next spring, both of us. Some screenings stopped for women. She had stage 4 cervical cancer. She had a bowel resection. She had a hysterectomy. She had chemotherapy, and she's finishing her radiation this month. She's a youth pastor. She's the daughter of a minister. This can happen to anybody. Her husband died, I think, about 8 years ago. And this is a crafty virus. I'm telling you, it's not to be trusted, and we need to stop the incidence. And unfortunately, her brother died this year from oropharyngeal cancers, HPV related. Like I said, it can happen to anybody. And we have a responsibility, because when we miss an opportunity for HPV vaccine, we create an opportunity for cancer. And like I said, my reference slide is not in APA format this week, but the URLs to resources are at the bottom of each slide. And I really want to thank you guys for this opportunity, and I'm happy to answer any questions with my remaining time.
Thank you so much, Gail.
I'd love to go back to that slide with the rates on it, or the coverage, just to explain. Come on, where is it? So that people can see their counties. So this is for completion for this year, Q1 2024, for if they've had 2 or 3, depending upon their age group, completion rates for 13 to 18-year-olds in Arizona or in your counties independently, if you're interested. So,
and like Gail said, we will put her slides on the website as well. And so if you'd like to access this after the training, we will have that too.
And also, if you do use this slide from the ADHS Bureau of Immunization Services, new name, I found that out yesterday too. And you do have to ask permission to share. So.
One question in the chat, Desiree, would it still be effective to get HPV vaccination for individuals in their 20s? Yes, yes, yes. You can go up to age 46.
So up to age 26, it's just a standard immunization. There's no issue with reimbursement. There should be, because it should be first dollar coverage for vaccines up to age 26. From 26 to 45, and that means 45 and 364 days, so almost 46. You have to have what's called shared decision making, and so that the record has to reflect that you discuss this with your provider and you feel that you may be at risk, for any reason.
Okay. All right, so if you have time, Gail, to answer some questions in the chat as we move on to the next presenter, that would be great. Thank you so much.
Okay, let's see. Let me unshare my, oh, here it is.
Okay, good. Okay, now we are going to talk about the immunization data report, which is always a very interesting subject to all of you who have to fill that out every year. So we have Lauren Krebs. She's an epidemiologist from the Department of Health Services, and now she is the expert on the immunization data report. So thank you so much, Lauren, for coming and talking to us today. And she will also be available for questions and kind of go through everything. So I will stop sharing and let you share your screen, Lauren.
Trying to figure this out.
So the green button at the bottom toolbar is the share button. On my screen, it's in the middle.
Oops. Gonna have to share my whole screen, I guess.
Okay.
Oh, I had it all set up. I am so sorry for this.
That's okay.
All right. I think I got it.
Yep, there you go. Looks
Perfect.
great.
All right, so I am going to be talking about the immunization data report, specifically this year's, if there was any updates. And why is it not advancing? There we go. So I'm going to be going over what it is, who it needs to complete it, why it's important, just kind of going over filling it out and how to do that. And then at the end of this presentation, I attach some guides and helpful resources. So the IDR is an annual state-level self-reported survey about routine childhood immunizations. It's roughly 40 questions, and it opens early September, and then it is due by November 15th every year. November 15th is a hard deadline, so definitely start it prior to that in case you have any issues with logging in or questions about immunizations. To reach out to us so you have time to complete it, because we are not able to go back and reopen it once that date has passed. And it assesses immunization coverage and exemption data from childcare and preschoolers, kindergartners, and sixth graders. And it's intended to be a representative sample of immunization coverage in Arizona. So who needs to complete it? All licensed childcare providers with children who are 18 months to 5 years of age. This includes childcare centers, home-based providers, Head Start or early Head Start schools, preschools, and pre-kindergarten. And then all schools that serve children who are in kindergarten or sixth grade. Doesn't matter if it's public, private, or a charter school, it needs to be filled out. And then schools with 10 or fewer kids need to acknowledge the IDR by still registering for it and adding their school. But then the first question is if there are 10 or fewer students. So if they do have 10 or fewer students, then there is no data that needs to be associated with that. It's just that one-click button to submit. And typically the IDR is filled out by a school nurse. If a school doesn't have the nurse, then a health aide or front office staff. Why is it important? So it is one of the main factors in determining state and local health department activities in regards to immunizations. It helps to identify pockets of under-vaccinated students, parents, and just any public person can look at each school's exemption rates. So this might be particularly concerning during enrollment, if someone has a child who is immunocompromised and they are really worried about the herd immunity around their child. It also supports additional measures to assess community vulnerability. And then the data from the IDR is shared with the CDC, community stakeholders, and community members. So on the left there, that is the school vax view on the CDC website. So every year, the CDC collects data from all kindergartners. And there's a lot of different filters you can go down on there. You can look at like exemption rates. You can go by each vaccine type, and you could compare states. So it's really interesting. But this is how the CDC gathers this data, is using the state's immunization data records. And then on the right there, that is on the AZDHS website. You can go through previous years and stuff and just kind of look at trends. You can also look up like county specifics. So I have attached this website at the end of the presentation as well. But if you also click on that URL right there, then that will take you to both sites. And it's very interesting to kind of click around and see where your school or community falls. So then filling out the IDR. So before you actually log in and start, filling out all the information, you're going to want to gather all of the students' immunization records. And that will be for the age of the student as of the date that you submit the report. So that is for 18 months through 5 years of age. So if there is a child who is 16 or 17 months right now, but maybe in a couple months they have a birthday coming up, don't include them. It's as of the time you are filling it out, their age. Also, it's particularly important for 6th graders because 12 years old is the Tdap and meningococcal vaccine requirements. So just to pay attention to the child's birthday. You do not need to submit information for children younger than 18 months. You will submit total counts rather than individual children's records. So we don't get any personal identification information. It is just the total number. It's like there's 100 students at the school, maybe 75 are vaccinated, and then this many have an exemption on file, this many are non-compliant. So we don't want to know the individual, we just want to know the total number. And you will also submit how many children have exemptions to every vaccine. So it's not just going to be this many have an exemption. It's going to be this many have an exemption for polio, or this many have an exemption for the MMR vaccine. So it does go by each specific vaccination type. So then once you have gathered all that information, you are going to log in or register for the IDR at the homepage, which is just azidr.gov. And registration is going to be required for anyone new to the IDR, if this is your first year filling it out, or if you have previously filled out an IDR, but you have a new email address. And then previous IDR users can log in with the same email address and password as last year. If you forgot your password, you can just reset it. And it is important to note that it is different than the ACES password. So they are not connected. They are two separate things. So the passwords would be different unless you use the same password for everything. And then at the bottom, so here you can, there are tutorials attached for the childcare preschool IDR and the kindergarten and 6th grade IDR. So if you need additional help, those are really handy. So then once you log in, this is what the homepage looks like. There's separate lists for children, or for childcare and preschool facilities, and then for grade school, kindergarten, 6th grade. You will see both of them pop up, but they might be blank if you don't have a school for that. Yeah, so preschoolers will only be available for schools you have a child care or preschool list, and then kindergartner and sixth grades will be underneath in here. And you can just click between if you have multiple schools that you're reporting to. And then survey in progresses will turn from gray to yellow. So if you have not started, it's going to be grayed out. If you're kind of halfway through, it's going to be yellow. And then if you completed it, it's green. So green is good. And then once you complete it, you will be able to print out a PDF. And the PDF is for your records only. It doesn't need to be submitted to ADHS. And then modifications can be made after you've completed a survey up until November 15th. So if you complete it early, you can go back and make any additional edits, but up until that November 15th deadline. And then tips, save your work often. If you are logged out due to, prolonged inactivity or something happens, your computer shuts down, you're going to lose your unsaved work. So save your work often. And the questions in the kindergarten and sixth grade surveys pertain to all children in the grade level, regardless of their chronological age. So if, there's a 4-year-old kindergartner, or someone's like skipped a grade or they're kind of young for their grade, they still need to go based off of the grade requirements. Answer each question as accurately as possible, and then make sure the numbers that you enter equal the total enrollment number. If you need any help with filling out the IDR, if you have if you need assistance with like foreign vaccine records, or maybe verifying vaccines, you can definitely reach out to your county health department. They are a great resource, and I have attached the phone number for each different counties. And here is links and resources. The immunization handbook is super, super helpful. It goes over all of the rules and requirements for each immunization, or what to do in different instances. And then just the immunization quick look toolkit is just kind of a quick overview. The immunization handbook is definitely more of a deep dive. And that is all I have. If you have any specific IDR questions, you can email azidr@azdhs.gov. You can also reach out to me, or you can call me at my work number there. And then if you have vaccine or related questions, Kate Whitman and Sharon Sweeney are awesome. They very, very helpful and can definitely answer like any clinical questions that you have. Thank you.
Awesome. Thank you so much, Lauren. Can you put the link to where to find the report in the chat? I know you mentioned it, but if you could put the direct link, we have a few people asking for that. And then I have a very specific question for you. And okay, so Patty says, I recently had a family join my preschool with 2 young children. They are originally from Phoenix, but the parents relocated to Poland, and now they're back, I'm guessing. Both parents are doctors. Children were vaccinated in Poland, and they do not have documentation on vaccines. Mom says both children were vaccinated. What do we do? So Patty needs to fill out this IDR and include these 2 children.
Mm-hmm.
So what would you suggest?
So there's different resource or ways that you can. That is definitely like when you're dealing with international vaccine records too, it can be challenging. The county health departments have ways to help with that. I believe the health department vital records may be able to, but I would definitely reach out to maybe Kate or Sharon. I believe they have experience with that as well, because they've been doing this for a lot longer than I have. So I am sure that they have seen it all. So they would be a great resource. But if you want to drop your email, I will definitely make sure to reach out about that.
Awesome, thank you. Gail, you have
I have a comment, and we have a lot of school health personnel and nurses in the room that have loads of experience. So based on my experience, if they were born in Arizona, it's pretty likely, because we've had ACEs for a long, long time, 30 years or something. Yeah, so they might be in ACEs, and you could get the first primary series through ACEs. And then when we don't have a record, typically what pediatricians recommend is to just restart, and there's no harm to the child. And I just want to ask if that's still the case in the room with the other nurses. But I'd start looking in ACEs first.
So Patty, it sounds like we need to get a little more information, and then we'll be following up with you. Lauren, there are a few other questions in the chat, but we're going to continue with the training today. And then if you could stay on for a few minutes and answer those, that would be awesome. If your question does not get answered today, we can reach out to you after the training. So thank you so much. That's awesome.
Thank you.
Okay. So I think we're all ready for a trivia question. So who needs to complete an IDR? Please put your answer in the chat. Licensed childcare providers, schools, preschools, or D, all of the above? Let's hear if you were listening to Lauren, and you guys were. Awesome. Everyone agrees the answer is D. Okay, I have another one right away. Question, I can't find a record in ACEs for my student. This means they are not vaccinated. True, false, or not sure? Okay. The answer could be B or C. It's okay if you're not sure, but that is false. Students may not have a record in ACEs if they have recently moved from out of state, or their provider hasn't entered the immunizations into ACEs, or the patient record needs to be merged with another record, but that does not mean they are not vaccinated. So you can contact the ACEs help desk if you need help with that to find them or merge them. Okay. What are some questions that you're hearing? What are parents asking you about when you say it's time to vaccinate? You highlight the form and you highlight that HPV vaccination. What are the questions that you are hearing? We would love to hear them. Our last presenter for today is a longtime school nurse. She's an alumni of the school nurses. Lynn Moriarty, she is a community health nurse, now working at Wesley Community and Health Centers, but she has 30 years of school nursing experience. So I asked her to come and talk with us and do some kind of quick answers to some questions that you all submitted during the registration process. So we're just going to dive right into those. Okay, Lynn, first question. Hopefully you're unmuted. I take care of enrollment and take care of immunization records. Parents do not understand how crucial immunizations and school go hand in hand. Some information and guidance would be great. So kind of like a general answer, how would you talk to the parents, how to help them understand how important it is that their kids are immunized?
Hi, everybody. I know lots of you guys on this call as well. And I have to correct Laura, I'm pretty old, but I'd say more like 20 years school nursing and 10 in miscellaneous, I would say. And I really miss it. So I empathize with Gail. School nursing was great. But the pandemic kind of did me in. So here I am back in a community health center. But we are doing some school-based outreach, so I do get to do a little of that still. For someone who is working with enrollment and taking care of immunization records, they might be a nurse, they might not be, they might be front office. Most parents understand that immunizations are part of the documents they need to present when they enroll a kiddo in school. So I would go back to, if they're questioning why it's so important, I would go back to our community immunity information and just have a quick elevator speech on that. Laura's fence analogy works great. Letting them know that we're not only protecting their student, but their student might be protecting a student who can't get shots. And I think we often forget how many vulnerable staff we have. I mean, schools are a place where people with some fairly complex medical needs can work. They are accessible. So our staff is really high risk. And I think we all learned that during the pandemic when our staff was so concerned about being in school, being close to each other. And also just post-pandemic, if you will, kids are back to the kind of interactions that Laura was talking about that give us colds, that bring us lice sometimes. So they are definitely going to be much more in close contact than they were during the pandemic. We all noticed how much other stuff went away when we were spacing and wearing masks and excluding kids rigorously. We've moved away from that. So kids are back to the same level of risk they had before. So I would repeat those things and then just remind them it's the state law. Hopefully you have the poster in your office and you can point to it, but it is the law, with a few exceptions. And just remember, in terms of compliance, when you're doing your IDR, I know that we like to have 100% across the board on all our immunizations, but really your compliance and the level of protection are not really equal. If you have a lot of exemptions and only 50% compliance, your school is at risk. And that is public information. I'm glad Lauren pointed that out.
Next question, can you please review the catch-up schedule on new TDAP and MCV recommendations?
That one I had to look up because I haven't been in schools in a little while. I'm much relieved to see that they did make some changes. And those are all outlined in the ADHS guides for you. But the important thing that I learned was that students have until they turn 12 to get both of those shots and be in compliance. So in the past, we would exclude a student who was 11 and not presenting those shots, or maybe not enroll them. You can enroll them. You just want to let their parents know that they need those shots by the time they turn 12. And both of those two shots also count for that requirement if they get them when they're 10, though they might not if they got them earlier. So I would check with your ADHS experts if you have earlier doses. But at 10, they would still be accepted.
Okay, awesome. We can also send that link with the thank you email just so you can all have that catch-up schedule and the new recommendations. Next question, when does it become necessary to exclude exempted students in case of a measles outbreak or exposure? Is this district specific?
I think this scenario was like my nightmare, and fortunately I never had to deal with it. I worked for 3 different school districts and I think we had a few close calls, but I have not experienced this. So if anyone else wants to jump in, please do. But I have always worked in Maricopa County. We have a great public health department. This is definitely public health department material. A school or a district should not try to deal with even a measles case that's been on campus without involving their local public health department. And they will be very specific and very helpful in assisting you and your administrators in communicating with parents and the public and the community. But measles is incredibly serious and incredibly contagious. My assumption is that you would be excluding kids who had definite exposure and maybe even more. So you would want to be assembling your list of kids who are exempted from measles or are not up to date, who are not fully vaccinated for measles. And this is just a good time to mention that a lot of personal belief exemptions end up going to families who started their kids with immunizations and for whatever reason, barriers, other internal reasons, they want an exemption so they can enroll their kid immediately. Check every kid who has an exemption on ACEs, because lots of them are fully immunized up to age 4 or 5. And in this case, you might find a child who does not need to be excluded in an outbreak. So we always made it a policy to look up those kids and enter all the immunizations they have, regardless of whether or not they had an exemption on file.
That's such a great point. I never would have thought about that. You kind of see this list of exemptions and you're like, oh, okay, they must not have any, but such a great standard of practice to put into place. That's awesome.
It's also a good reason to include the non-school requireds, especially for school age and particularly for Hep A, because if something went awry in the cafeteria, a lot of our kids have come through childcare in Arizona and have fully Hep A vaccines, and so it's important to enter them regardless of the age of the child.
Okay. Next question. How can we enforce immunizations without support from our district? We get this question about 10 times every training, and anytime we go to the school nurse conference, we hear this over and over and over again. So Lynn, what is your answer?
There's no magic answer. It's a really complex question. I try to frame it in the context of Arizona's open enrollment and charter school system has introduced sort of a level of competition for kids in seats that I recognize through my career here as a school nurse, where schools don't want to create barriers. So, administrators are under some level of pressure to enroll as many kids as they can. So there's some competing interests going on. But that said, I think the first thing that you do is meet with your site administrator, because by law, they are the person responsible for the immunization compliance on your site. The health services staff can be delegated to assist with that, but it's ultimately up to them. So find out where they're at and be prepared to sell them with your herd immunity information, with your ideas about how to market your school as a safe school for kids who might be at risk or staff who might be at risk. But you need to know what they're thinking and why they might not be supporting you. I would also be prepared to share what your plan is for families that are not following up by getting immunizations. Your documented phone calls, your letters, your mailed letters, the resources you've provided, so that they can see how hard you've worked to try to bring this family to get immunizations. And try to think outside the box. Can you host an immunization event at your school or in your district? Do you have someone who might be able to drive a family to get immunizations? I know some of the rural folks have hours and hours to go to immunizations, but we need to make sure families have access before we start saying you're not following through with what we asked you to do. And then you need to see if your administrator is willing to exclude students who are non-compliant. I have certainly worked with principals who do not want to suspend a student in that situation. And at that point, you've done as much as you can. You want to keep checking in with the family and seeing if there are barriers you can reduce. But if you're unable to exclude a student, which should absolutely be a last resort, there's not much more you can do. It's sad.
I would love to hear from people who maybe have faced this before and any ideas of how they were able to overcome it. So kind of like a group comment in the chat box. If you have faced this before, if you were able to get some support from your district after talking to them, was there anything that you tried that worked? Please put it in the chat and we can all learn from each other. Lynn, I have a few other questions that came into the chat, if you don't mind answering those. A few questions about how can we get that state poster on the wall that says it's the law to be immunized. I am not familiar with that poster. I don't think I've seen it. We don't have it at TAPI. So if anyone knows where to get that poster, or if you remember from your school nurse days, Lynn.
The No Shots, No School poster comes from EDHS. And I think Kate Whitman is on this call. She might be able to direct you to how to exactly get that.
I have a copy, Lynn and Tappy. I can see if I can attach it.
Okay, awesome. And then we can put it on the website as well, and so you can find it easily. One last question before we kind of wrap up. Will the immunization education course for exemptions ever become the standard for all schools/providers?
And I'm going to
Laura,
defer to my EDHS people on that.
Laura, I put in the response.
You did?
Okay. I did, yeah. So the answer is that we know the pilot course is effective in increasing vaccine rates and decreasing use of exemptions by parents and guardians that watch it. However, the truth is, and I'm just being brutally honest, because of our political situation in Arizona, we don't want the course to be shut down. It is so valuable. So we're keeping it. I mean, we still have it available. We want folks to use it, but we are not requiring it because we know we'll get pushback.
Okay. Thank you. That's so helpful to have you answer that. If you have additional questions, please put them in the chat. We can follow up with you after the training. We have just about 4 or 5 minutes, and I want to talk about where you can find reliable resources. It's really important that you know where to find reliable sources of information and where you can send parents to find answers to their questions that are reliable. So this handout is on our website. There are websites specific to send you to CDC, Immunization Action Coalition, Vaccine Education Center with the Children's Hospital for Philadelphia. There are some apps, books, videos, phone numbers, all of that. Here are some resources. The Vaccine Education Center has many different videos on how to answer really hard questions. And sometimes it's great to let an expert like say it on a video and send it to a parent specifically. That can be really helpful. Also, we mentioned the CDC has lots of resources for immunization. TAPI has a webpage specifically for school nurses and health office staff. We are in the process of updating it, but it still has a lot of information that is great for you right now. There is a section for school nurses and health office staff, and then there's another section of resources to give to parents. And then we are adding a third section of resources for school administrators, school boards, school district superintendents, all of that. And so look for changes there. Blanca, if you haven't already, can you please put the link to that website in the chat? We will be emailing that as well. We also have some different resources. This one on the left is kind of like a question and answer, and it's really a helpful handout that you can give to parents that, is it important for my kid to get vaccinated if everyone else has their kids vaccinated? Why? Yes, why that is important. So it just kind of goes through those different answers. And then this is our website on the right, whyimmunize.org. On our website, we have many different resources that are free. And I love to bring this up because after every training, the school nurses start ordering stuff to put on their walls in their offices. So we have resources about what to flu season, how to stop the spread of germs, cover your cough, stay home if you're sick, all of that. We have COVID resources. We have the immunization schedules. This one on the very left bottom, it's kind of hard to see. One of my favorite, it has what vaccines are needed throughout the whole lifespan. It's really a great flyer to give to parents because it shows if they have a new baby, what vaccines are needed, their school-age child, their teenager, the parent themselves, the grandparent. It shows every vaccine that's needed at which age you are. So it's really easy to follow. So these resources are free on our website, and Blanca will put the chat in there as well. My favorite thing I love to talk about is Vaccines for Children, or VFC program. If the health insurance does not cover vaccines or the parent doesn't have health insurance, you can still get your children vaccinated against preventable diseases for free. It's a federally funded program called Vaccines for Children. Money should never be a reason why a child cannot get vaccinated. So contact your county health department for locations of where you can go, where you can send your parents. Thank you so much to our presenters. We have a survey that Blanca just put in the chat. We love to give prizes. We'll be giving some prizes to these award winners from today. But if you fill out the post-training evaluation, you will be entered into a drawing and 5 more prizes will go out. So please give us feedback on the training. We can improve this for next time. Tell us the good, tell us the bad, anything to improve for next time. We would be great. It would be great to hear what you have to say. If you are a registered nurse, social worker, a certified health education specialist, medical assistant, you can receive CEUs for today's training. If you are not one of those and you would like a certificate of completion, that is also available. So Blanca put the link to the CEU evaluation as well. So once again, thank you so much to all of our presenters. You all have a different background and a lot of great experience that helps us learn from each other. And we will be reaching out with responses to the questions that were not answered in today's training. We will offer this training again next year. About February is when we do that next training. But thank you so much for coming today. Thank you to our presenters, and hopefully you all had a great time. That's it. Thank you so much.